Caffeine. It's everywhere. According to a 2013 study published in the Journal of Caffeine Research, caffeine is the most widely used drug in the world. In the United States, more than 90% of adults use it regularly, and among them, average consumption is more than 200 milligrams of caffeine per day. More caffeine than is contained in 2 6-ounce cups of coffee or 5 12-ounce cans of soft drinks. While many coffee lovers and energy drink drinkers say they reap the benefits of having caffeine, is there a downside to it all? How exactly does caffeine affect your mental health? After all, it's been a much debated topic. So let's take a look at whether caffeine is an overall benefit or risk to your mental health. Number 1, should you have caffeine if you have a mood or anxiety disorder or a mental illness? Do you suffer from a mental illness? Do you also drink coffee? You may be wondering how this can affect your mental disorder. Well, after all, caffeine increases heart rate and blood pressure. So what does this do to someone with, let's say, an anxiety disorder? In a Psychology Today article, the Bronfenbrenner Center for Translational Research notes that caffeine can trigger anxiety, especially when drinking more than 1 cup a day, and in people who are more sensitive to coffee's effects. The author notes that it is important to understand there are large differences in how individuals process and react to caffeine. So have you noticed how caffeine affects your disorder symptoms? A study published in the journal Psychiatry Research focused on 43 patients and found that anxiety disorder patients have increased caffeine sensitivity, which leads to decreased consumption. It would seem to make sense that anxiety symptoms could indeed increase with even simply the increase in heart rate and blood pressure caffeine can provide. A 2005 Cambridge study published in the journal Advances in Psychiatric Treatment notes that psychiatrists rarely inquire about caffeine intake when assessing patients. This may lead to a failure to identify caffeine-related problems and offer appropriate interventions,